I'll be discussing about the two important mental health disorder, which is the persistent depressive disorder and premenstrual dysphoric disorder. Well, we go through about what disorder are and their cause, symptom, treatment, and some interesting facts about them. So let's start with the PDD or the persistent depressive disorder. So what is persistent depressive disorder or ano nga ba ang meron dito? So ang persistent depressive disorder or in short called PDD, also known as dysthymia, ito ay isang chronic mood disorder or it's mean matagal o tuloy-tuloy yung nararanasang symptoms of depression. Ito ay tumatagal for 2 years or higit pa for children and adolescents. Hindi siya ganito kalala ng major depressive disorder or yung MDD, but malaki pa rin yung effect nito sa buhay ng tao. It becomes mild but long-lasting. For example, no, imagine mo, pakiramdam mo malungkot ka or yung madali kang mapagod or wala kang energy halos araw-araw for 2 years, and then pakiramdam mo mabigat yung katawan mo na wala namang malinaw na dahilan, and that is the effect of PDD or persistent depressive disorder. Yung madali kang mapagod, hindi mo alam kung ano yung nararamdaman mo or hindi mo alam anong dahilan, no? Yan yung effect ng PDD. Kahit hindi man siya ganun kalala ng major depressive disorder, but long-lasting, no? Mild but long-lasting. Tumatagal ito siya ng for 2 years or higit pa. And that is the persistent depressive disorder. Now, let's proceed for the short history of persistent depressive disorder. So here are the short history of persistent depressive disorder. Dito, dating tinatawag na dysthymia ang PDD or persistent depressive disorder sa DSM-3, dati yon. Or tinatawag din na Diagnostic and Statistical Manual of Mental Disorder. In 2013, when DSM-5 pinagsama ito sa chronic major depression at pinalitan ng pangalan na tinatawag na natin ngayon na persistent depressive disorder. Take note, yung pagbabago ng pangalan mula sa dysthymia to PDD ay ginagawa para daw mas malinaw kung gaano katagal at kabigat yung effect ng disorder na to. And that is the short history of persistent depressive disorder. Now let's proceed for the cause of PDD. Naalamin naman natin yung mga cause. Now, the cause for PDD. We have here the 3 causes kung bakit nagkakaroon ng PDD according to DSM-5 and base na rin sa nabasa ko. We have here temperamental factors, environmental factors, and genetic factors. Now, isa-isahin natin yan. For the temperamental factors, dito sa temperamental factors, yung mga traits or ugali ng isang tao tulad ng pagiging pessimist o padaling ma-stress ay pwedeng mag-contribute sa pagkakaroon ng PDD. Next one, the environmental factor. Dito naman yung mga stressful life events tulad ng trauma or pagkawala ng mahal mo sa buhay ay pwedeng mag-trigger ng PDD. And the last one is the genetic factors. Dito kung may history ng depression yung family mo, mas malaki ang chance na ma-develop ng PDD ang isang tao. Or pwede rin naman if yung parents mo ay may isa na naka-experience o may sakit na PDD, ay may chance na ma-adapt mo ang sakit na PDD. And that is the cause of PDD. Again, we have 3 causes of PDD. We have the temperamental, environmental, and genetic factors. Now, let's proceed for the symptoms for a PDD. Here are the symptoms of PDD. As you can see in my PPT, we have here the poor appetite or overeating. And next one is the low energy, low self-esteem, and poor concentration or difficulty making decision. And the last one is a feeling of hopelessness. Now, isa-isahin natin itong mga symptom na to. Unahin natin dito sa poor appetite or overeating. Dito, yung mga taong may PDD ay pwede rin silang mawala ng gana kumain or sobra-sobra yung pagkain nila. Depende yan sa tao, no, na mawala ng gana kumain or sobra-sobra yung pagkain nila, kasi minsan dito nako-comfort nila yung kanilang sarili or feeling nila matutulungan na mag-manage yung kanilang stress. And the second one is the low energy. Dito, yung mga taong may PDD ay lagi silang pagod, no? Kahit wala naman silang ginagawa or kahit sa simpleng bagay lang, no? Hirap silang kumilos. For example naman, no? Kung pagkagising mo pa lang sa umaga ay nakaramdam ka na ng pagod kahit wala ka namang ginagawa. And that is the low energy. Next one is the low self-esteem. Yung mga taong may PDD, dito madalas ang tingin nila, mababa yung tingin nila sa kanilang sarili, no? Parang wala silang kwenta, no? Hindi sapat yung ginagawa nila dito. For example naman, no, kung kahit sobra yung pagiging productive mo, minsan iniisip mo pa rin na hindi sapat o wala kang ma-achieve. And that is the low self-esteem. Next one is the poor concentration or difficulty making decision. Dito, yung mga taong may PDD ay hirap silang mag-concentrate or mag-decision kahit sa mga simpleng bagay lang. For example, no, kung pipili ka ng pauulamin mo, nahihirapan ka pa mag-decide or wala kang focus. And that is the poor concentration or difficulty making decision. And the last one is a feeling of hopelessness. Yung nakakaranas ng PDD, pakiramdam nila is nakakaramdam sila ng kawalan ng pag-asa, na walang direksyon ng kanilang buhay or walang magandang future para sa kanila, no? For example na lang, yung lagi mong iniisip na parang wala ng solusyon yung mga problema mo, ganun. Mga feeling of hopelessness, nawawalan ng pag-asa or nakakaramdam ng kawalan ng pag-asa. And that is the feeling of hopelessness. Again, we have the symptoms of PDD, no? Meron tayong poor appetite or overeating, and low energy, low self-esteem, poor concentration or difficulty making decision, and the feeling of hopelessness. Next, let's proceed on the treatment of PDD. So here are the treatment of PDD. As you can see in my PPT, we have here psychotherapy and medication. So isa-isahin natin itong mga treatment na to. The first one is the psychotherapy. Dito, effective yung therapy talaga, lalo na yung cognitive behavioral therapy or in short called CBT, para matulungan yung mga negative thoughts patterns, no, yung mga nakakaranas ng mga tao ng negative thoughts pattern, matulungan natin sa pamamagitan ng therapy. Next, the medication. This medication na to, pasok dito yung antidepressant or like yung SSRIs or tinatawag natin selective serotonin reuptake inhibitors. Dito madalas na nire-reseta para matulungan yung mood regulation natin. So yan yung mga treatment of PDD, no, yung psychotherapy and medication. Pwede rin itong pagsabayin, no, combination, itong psychotherapy and medication. And next, let's proceed on the interesting facts or yung testimonial ng mga artists or famous people na nakaranas ng persistent depressive disorder. Isa dito si Winston Churchill, a famous historical figure. Isa siya sa nakaranas ng depression na tinatawag niyang Black Dog. Ang kanyang experience ay nagbibigay ng visibility at awareness sa persistent depressive disorder at sa mga effect nito. So that's it, my first topic about the persistent depressive disorder. Now let's proceed on the premenstrual dysphoric disorder. The next topic is about premenstrual dysphoric disorder. So what is a premenstrual dysphoric disorder? Ano nga ba ang meron dito? Ang premenstrual dysphoric disorder or in short called PMDD ay isang severe form ng PMS or yung premenstrual syndrome. Kung yung PMS is common and can affect mood and physical health, ang PMDD naman ay mas matindi at nakaka-epekto sa emotion at ugali bago mag-menstruation. It causes severe mood swing, irritability, and physical symptoms. Kung yung normal lang ng PMS ay nakakairita, ang PMDD naman ay sobrang intense at minsan hindi ka na makaka-function ng maayos. So that is premenstrual dysphoric disorder. Now let's proceed for the short history of PMDD. So, ang PMDD was original seen as a severe form ng PMS at tinatawag ding late luteal phase dysphoric disorder. Yung mga nakaraang taon lang officially recognized as a separate mood disorder ng distinct mula sa PMS. So that is the short history of PMDD. Now let's proceed for the cause of PMDD. Alamin naman natin dito. So here are the cause of PMDD. Actually, wala talagang eksaktong natukoy na main cause ng premenstrual dysphoric disorder. But base rin sa nabasa ko sa DSM-5, no, minsan talaga cause nito is yung sa hormonal changes or hormonal sensitivity. But pasok pa rin yung environmental factors. So we have here the environmental factors and hormonal sensitivity. So yung environmental factors, dito yung mga stressful na situation o lifestyle ay pwedeng magpalala ng symptoms ng PMDD. And yung hormonal sensitivity naman, no, ang PMMD ay closely related sa hormonal changes na nangyayari sa menstrual cycle, lalo na sa luteal phase. So, yan yung mga cause ng PMDD na actually nabasa ko sa DSM-5 at sa mga na-search ko. So, yan yung cause of PMDD. Pasok dyan yung environmental factors and the hormonal sensitivity or hormonal changes. Next, let's proceed to the symptoms of PMDD. Alam mo naman natin yung mga symptoms niya dito. So, here are the symptoms of PMDD. As you can see in my PPT, we have here emotional symptom and physical symptoms. So, isa-isahin natin. Dito sa emotional symptoms, dito lumalabas yung gaya ng mood swing, anger, irritability, feeling of hopelessness, crying, difficulty concentration, or anxiety. Yan yung mga nararamdaman mo or na-experience mo kapag may emotional symptoms ka. Now, for example, may mga araw na kahit maliit na bagay ay nakakagalit or sobrang nakakapagsama ng loob mo at minsan naman parang walang control sa emotion. And yan yung mga nararanasan mo or yan yung effect ng emotional symptoms sa PMDD. Next, the physical symptoms naman gaya ng sleeping problem, cramps, headache or joint and muscle pain or breast tenderness. Yan yung mga nararamdaman mo or na-experience mo sa physical symptoms. No? Madalas nararamdaman mo yung sakit ng katawan, like pagbigat ng dibdib mo or pananakit ng kasukasuan. So that is physical or that is the effect of the physical symptoms ng PMDD. So again, we have the two symptoms of PMDD. The emotional symptoms, ipasok dyan yung anger, crying, no? Feeling of hopelessness, poor concentration or anxiety, irritability. And next naman, sa physical symptoms, pasok dyan yung sleeping problem, breast tenderness, or joint and muscle pain. Yan yung mga symptoms of PMDD. Now, let's proceed to the treatment of PDD. So here are the treatment of PDD. We have here medication, psychotherapy, lifestyle changes. Isa-isahin natin yan. Unahin muna natin sa medication. So ano nga ba meron dito sa medication? No? Dito yung antidepressant or birth control pills para ma-regulate ang emotional symptoms. Actually, dito sa antidepressant, pasok pa rin yung SSRS or yung selective serotonin reuptake inhibitors. Kasi actually, na-approve ito ng FDA or yung Food and Drug Administration para sa treatment ng PMDD na pwede lang to inumin kapag nakakaramdam ka ng PMDD. So next, psychotherapy, yung counseling or yung cognitive behavioral therapy para sa pag-manage ng emotional distress. Next, yung lifestyle changes like regular exercises, healthy diet at stress management techniques and para mabawasan yung severity ng symptoms. So that is the treatment of PMDD. Again, we have the medication, psychotherapy, and the lifestyle changes. Now let's proceed for the interesting facts about the PMDD or yung testimonial like ng mga famous artists. Isa na dito, si Sarah Silverman, isang comedian, ay openly na nag-share tungkol sa kanyang experience with sa PMDD. Sabi niya, sobrang naepektuhan ng mood niya to the point na hirap na siyang magtrabaho at kumilos. Nagpapatunay na ito na ang disorder ng PMDD ay super intense pagdating sa mga babae or nakakaranas ng mga babae kapag nakakaranas sila ng PMDD or Premenstrual Dysphoric Disorder. So that's it for my topic of Premenstrual Dysphoric Disorder and also for the persistent depressive disorder. And that's all. Thanks for your listening and watching. Thank you po.